Next we have Dr. Ankith Nair, who is going to talk to us about the 3D printed eye drop guide and the do-it-yourself eye drop guide which he developed during his post-graduation. Over to you, Dr. Ankith. So during post-graduation, you can do this.
Thank you. Good morning all. So I'll admit firsthand that glorifying eye drop guides isn't exactly what most of you gathered here might consider revolutionary or groundbreaking. But I have a case to make for a device, an often ignored device that can tackle how we, that can transform how we tackle adherence failures and wasted medications. We have all come across that elderly patient who lives in solitude and wondered if they can actually follow the regimen that we've prescribed to them. Curious, we asked them to demonstrate how they apply their eye drops. And we usually see one of these. It's either the anxious one or the one who's not even close, the artificial tears, or the classic tip toucher. In fact, studies show that 6.8% of patients miss their eye, 28% contaminate the bottle tip, and only 3% patients show perfect drop installation technique. And the mean drops per installation was 1.8. So your eye drop bottle will most likely last half of what you'd expect it to. So it was another day during my residency when I came across this device when a pharma rep was giving away free samples. So there was this problem of self-administering eye drops, and it had apparently already been solved, and most of us didn't know about it. So was it a gimmick? If it worked, it should have also been a relevant therapeutic device, right? So imagine my surprise when I realized that it actually resolves the whole ordeal, the whole mini circus involving the frittering hands, the anxious blinking, and the eventual wet cheeks. And the process was as simple as 1, 2, and done. Turns out eye drop guides have been around for a while in a huge assortment of models specifically designed for unique purposes. There is apparently a perfect eye drop guide for everyone. If you have tremors or weak extremities, you have these squeeze assist models. If you're a one-night patient, you have these models with built-in mirrors attached. Or you just don't like the idea of something falling into your eyes. You have these models, these touch applicator models. So I ordered a bunch of them and tested them out on my peers. Some were a hit, others were not, and there wasn't a clear winning design. And I figured out why. It wasn't the design that mattered, but it was the size of the eye drop guide. Specifically, we have different size skulls, so it leads to different orbital shapes and sizes as well. So I took this issue to my mentor, Dr. John Davis, and you can probably guess where that landed me. So let's just look at how easy it is to make our own eye drop guides. No, you do not need to know any 3D product designing skills to get started, because there are websites like these Thingiverse or Printables that has a wide variety of design templates that you can download. So these are, the design is not our main concern here. You can have your pick, and also you can of course choose the color at the time of printing it. But before heading out, you want to take a ruler and roughly get your orbital margins measured. This will be the size of the base of the eye drop guide. The next size will of course be according to the eye drop bottle. So these are some models that I printed and again tested them out on my colleagues. And as you would expect, they were favored clearly over using just any random commercial eye drop guides. But as I say this, I realized that asking the elderly patient, which I mentioned earlier, to go print his own eye drop guide or order a 3,000 rupees one off Amazon is not a practical ask. So not to mention 3D printing isn't as mainstream a thing yet, maybe outside of engineering colleges. So in between all of this, I also came up with a DIY solution for easily applying your own eye drops. What you do is you go to any baby shop near you and you get yourself a silicone feeding bottle teat. It has to be silicone. Make sure it's not too compliant so that it doesn't collapse in case you put too much pressure on it, which you shouldn't need to do, by the way. Also, if they ask you what the age of the baby is, just say a random age. Don't say that you're not married yet, because it might be confusing. What you do now is you cut it out at the widest margin, and that's it. You have yourself a makeshift eye drop guide. Why this works? It already comes in different sizes according to the size of the age of the baby. It's made of silicone, so it melts into your eyelid creases and takes shape perfectly, so it's super comfortable on the skin. Also, since it's silicone, it can be sterilized by steaming, boiling, and it's even microwave safe. All the while, even the most premium ones costing you less than 100 rupees. The participants, in fact, remarked that it felt nicer to use than those 3D printed materials and the plastic commercial ones. By making this presentation, I'm hoping to encourage more of us to educate our patients, especially the alarmingly rising number of elderly, or anyone else for that matter, who wouldn't prefer to disturb their parents, their partners, or their children to help them apply eye drops, say, every 4 hours. Here's hoping for a future where everyone, young or old, apply their eye drops independently.